together this very important program and tracking this rather very crucial pandemic. My name is Desmond Alugnoa, as Kati mentioned, and my organization, GreenAfrica Youth Organization, is based in Ghana, even though we work in other African countries as well, but our focus, our strength is in Ghana. And the focus of Green Africa Youth Organization is sustainable community development and circular economy. So it's a youth-led gender-balanced organization that started about 6 years ago, focusing on creating awareness of climate change and helping communities to resist or to withstand disaster risk. But then we evolve into now implementing projects in the sustainable community development and the area of circular economy and waste management. Myself, I recently finished a second master in the University of Potsdam, which is in geogovernance. Focus is on the governance of sustainability and climate change, and then also in line of the future of work. Yeah, I think by way of introduction, this is me. I'm from Ghana.
Perfect. Great. It's really a pleasure to have you. And now, the organization was obviously, like most people, doing other things before the pandemic. But why don't you tell us a little bit about the experience of the pandemic in Ghana and how the community responded to it, how the government responded to it, and then we can talk about your particular role.
Okay. I mean the pandemic. I think the first news that we got was barely online and then on the television, and so the country had already had this bit of panic or sort of fear by hearing this when it started all over the news in China and about China, and also when it moved to parts of Europe. We had the first case in March this year, and upon this first case, I think it was still a mixture of uncertainty as whether it's actually true that we have recorded cases or it is not, until the government confirmed somewhere at the middle of the month, and then it was met with, I would rather say, quite a good response, sort of early action, with strong regulations started by the government in terms of closing the borders, in terms of regulating the movement within the country. So the regulations started with the external and also the internal borders. Internal borders here, I'm referring to the various regions, whereas in other countries we call them states. So usually people easily move from the other less congested regions to the bigger cities where there are business opportunities, where there are other things. So there was a quick step to ensure that those people concentrated in the cities do not just go back to the other regions, because you don't know, probably some of them have already contracted something or not. And then the first case also had had kind of a unique situation, because it was, of course, brought in. So it was an imported case. So it triggered the issue of the contact tracing, and that was what the government did. And they traced the contact, and they made sure that they got so many people who were tested negative, but with time, some people tested positive, as they kept them as in isolation. And this was a good approach, I would say, even though it wasn't as efficient as it could have been. And I'm only saying this based on the aftermath, the fact that still upon that serious contact tracing, it didn't contain the pandemic.
So, so that's very helpful. I think that why don't you describe a little bit how it progressed from there? So once there were cases of internal community transmission, how did people respond and address it?
Yeah, so the response of people was, I mean, the early months was pretty good. The response was pretty good, and it was pretty good because Ghana is quite a very informal country where the word of mouth still exists so much. So people have these networks that they just communicate, and through this communication, people understand and people take measures. So government give the protocols, government give the instructions, but the rest was about what the people do with it. So community organizations started to educate people, the various religious bodies started to educate people, households started to educate themselves about what it means by social distancing, what it means by hand washing and all that. And I think one of the other significant steps was the fact that the apparatus or the materials that most of the COVID-19 campaigns had outlined, that you need to have wash your hands under running water, you need to wear nose masks when you are going to crowded places, and all that. They were the limitations from the beginning because people didn't prepare in this way. So even though people responded positively with the intangible part, this part needed a step in. And so one thing was inter-community learning, something we call inter-community learning, whereby first community improvised, tailors make nose masks, people improvise and use some maybe alcohol to make hand sanitizers, make liquid soap, use some sort of buckets to create a sort of innovative way to have running water running for you to wash your hands. And one community learn from it, another community learn from that, another community take it from there, and then this kind of circulated around almost everywhere in the country. So people didn't really have to buy some of these things to make sure that they are able to practice their personal hygiene that was associated with the COVID campaigns. The other thing that that measured community response was also the change in behavior. For example, as a highly informal community, you would usually see a lot of people always hugging, shaking hands, worshiping in the church, touching stuff. But then all of a sudden, people begin to distance themselves from some of these activities, even in the smaller communities. And if you notice, we also live in a country where there's not really an effective mass transportation. So transportation is much more about mini buses that take a maximum of 20 people, 17, 15 people. So this is also one of the things that made this community response quite effective, because the buses are smaller and usually their windows are just open as they move around. So even at the point where people started to buy stuff to go home, because you are thinking maybe there will be a lockdown tomorrow, there might be a lockdown tomorrow next, this movement didn't expose them that much as compared to perhaps if they were supposed to be hundreds of people locked up in a long bus or a long train with probably not so much ventilation.
Great. Now, once people began to realize that the virus was around, you told me a little bit about how people would watch. Why don't you explain that? I think that was really insightful.
Yeah, again, because except in the very big cities. Even in the very big cities, we still have so much reliance on the instructions of our traditional authorities and community leaders. So one thing that was quite helpful, if I get your question right, it has to do will have to do with how communities supported with the contact tracing and
Correct. Yeah.
yeah, and early reporting of
Right.
issues. So, for example, communities started to alert the traditional authorities wherever there is no government or wherever there is no military presence, because the first lockdown had military and police people on the streets, but not everywhere. So communities always report. So somebody moved from perhaps a city to his home or to a friend's place before the lockdown, community alerts whichever traditional authority is in charge of that. Oh, Mr. So and so have come home, and then they take it up from there, and then they try to keep this person, or they try to monitor this person, and then the slightest sign of cold or something, they refer the person to the health centers, which was very, very helpful because for a long time, when the first case was recorded in March in the city, there was no case elsewhere in the other regions, especially in the regions that are that have less people. And that was because government instructions in the cities were quite effective. So people boarding buses were tested, and you don't just board a bus and 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 so transporting these cases wasn't that likely. But for people who traveled because who traveled with maybe not symptoms or tested negative, but then developed maybe uh, symptoms along the way or whatever means, because of this reporting at the community level, then it wasn't able to spread to other people, even when they finally cross borders to another region of the country.
Yeah. So the main thing is that people of the communities, wherever they were, including in the cities and outside, were just aware. They were paying attention to what was going on. People would know if someone came in and would be engaging with them to make sure that if they developed symptoms, they would isolate.
Yes, yes. I think the right word is watching each other or taking care of each other. So the panic level at the beginning was quite high. People didn't understand to what extent the pandemic or the disease is like, and so avoidance was very much on the top of the list. I mean, so far a bit have changed. Some things have changed with respect to how much people were conscious about keeping each other's gate closed. But yeah, this really helped at the beginning.
Okay. So why don't and we can talk a little bit more about what's happening, but why don't you start to talk about your organization and what
Mhm.
you were participating in, what your engagement was as an organization?
Um, yeah, so my organization, the GreenAfrica Youth Organization, and of course, I must also mention that very large collective of other civil society organizations were part of this. I think our beginning was more about community engagement and awareness creation, where wherever we work in actively in about 3 regions of the country, and we make sure that we engage community people, further explain or spread the word. And most of these communities are also not people are just on daily basis, either in the market, on the farm, or going out for business, and do not always have the privilege to be sitting by a television or to be sitting by a radio and picking all the necessary precautions. So the first thing was to engage these communities, further educate them on how to avoid getting it, and give them the basic understanding of what the symptoms are like and what you are supposed to do when you experience something like that. I think going further, when government initiated a lockdown, I think that was where we had to act harder, because upon enacting the lockdown, there were schools had to close down. So when schools closed down, everybody went home. Now, if you know that a lot of homes, whether cities or rural areas in Ghana, have sometimes one room, more than 2-3 people in one room. And when schools were locked down, it means that number of people in the household increases. And that means that we had talked about social distancing. We had talked about keeping a pace with your family members. But then when it increases, what do we do? You have to increase the awareness creation of what do they do, how to keep their rooms ventilated, how to clean certain things, like opening the door and somebody else coming to open the same door and stuff like that. So that was with awareness creation. But then after a few weeks into the lockdown, there was also the need to step up with materials and in some cases financial support. For example, in GreenAfrica Youth organization, we work a lot with women and children in waste management. So our waste pickers are women, largely women, who have families also on their own. And just not apart from those we work, there were other community people whose daily life depended on how much they make from the market. So sitting at home, it became very, very much worrying that we had to step in to provide food stuff to some of the community people, to provide counseling, sort of just to keep the people energy high, and also making of the materials available, nose mask, hand sanitizers, improvising, making liquid soap, and we have something we call Veronica bucket, which is just an improvisation of a running tap, because in most homes in Ghana, we do not have the taps running like that. So people always have to fetch water. Somebody come and fetch with the same cup to wash hands. So we had to improvise these things. So community by community, we started to provide these basic materials, including the hand sanitizers and the nose mask, to facilitate whatever they do in their homes. And then in the critical situations, we actually provided financial support to some of the homes by way of helping them to buy their basic food needs, basically food needs, and also supplying some of them actually with food items. And this was quite similar with other organizations that I know, even though they have less capacity. But I also saw that most other organizations and churches also did the same. Another thing that was that was essential was the fact that we had to make sure that people who do not feel good and they are going to clinics or hospitals, sometimes they come from different communities. And so we positioned certain materials also at these places, because if you are going to the hospital and you do not wear, for example, a nose mask, there's no doctor that would be willing to consult, because I mean, we don't know what you are coming with. So usually the doctors will also urge you that come with a nose mask. And if you don't have it, it's not good. So at the entry point, you are given a nose mask, and then you go and they tell you whatever your situation is. So this was also very helpful after a few months into the complete lockdown. Of course, we couldn't continue this forever because the lockdown kept on for quite a long time. Even now, most parts of the country, schools are still closed down, except people who are in their final years. So it's more of the intangible stuff that most organizations still keep doing. But yeah, this is part of the work that civil society did, and of course also contributing to the early reporting, because we were kind of always trying to serve a bridge between where the situation is tensed. So you step in, and then you either facilitate with the early reporting, or you facilitate with the educating of the people.
So I think it's, quite clear the nature of the help that you provided to people. I would like to open up maybe to questions. Before we go there, Ghana now has under 100 cases per day on average in the last, and it hasn't, what I would say is that it's avoided, major outbreaks and dramatic increases as in other countries. There was a peak in July that went up to just under 800 cases per day. It's, again, as I said, now down to under 100, which is, clearly about a tenth of the cases that it had then, which is substantial progress. One of the questions that one might still ask is, why isn't it at zero? What would we need to do even more in order to get there? Do you have any thoughts about that?
Yeah, I mean, for a question like this, I think there's really not a straightforward A or B answer. But if I look at Ghana situation, and I look at other African countries that I was quite much aware of their early action steps, and then you look at the situation now, and even though it's not so much, it is equally not zero. I think in the case of Ghana, one of the issues was the fact that when so first there was a total lockdown, and part of the cases that were already imported contributed to the peak in July. And then the other contribution is probably the fact that so one thing I need to mention as a government step was government initially, also when they initiated the complete lockdown, exempted households from paying utility like electricity and water, which is very essential because it is one of the reasons why some families had to work harder. Exempted them for about 3 months. So this was very helpful. But then this was not like a continuous thing. So people, when measures started losing up, people started also coming out. And so you do not you cannot tell who is having who is having it and probably asymptomatic or something. So I think this also contributed to the peak. But then the issue of why is it not at zero at the moment, it's also the fact that at some point people always lose or even government lose certain level of control of the situation. So when you initiate a lockdown, this first lockdown comes with a combination of certain level of fear within the people, and then some level of panic. But as time goes by, as they get more understanding, as they also feel the economic pressure of their lives, they begin to disregard some of the protocols. And this also kept spreading bit by bit within people, even though the consciousness level is still very high. And that is why even after election, we still have not so much cases on daily basis. To get it to zero would have required perhaps that the regional protocols were more enhanced. And I'm referring to, for example, when they started and then the complete lockdown was in 3 major cities. This time it was difficult for you to move from, for example, the south to the north, because you are tested almost everywhere until you get to the north and you are tested again. And because of this, there were a lot of resistance, because people who were moving from the north to stay in the south to work, some of them were not really having good places to stay and wanted to run back home. But government realized that this was a risk and initiated these measures. And when they kept it that way, there were no cases elsewhere except some few individuals, about 7 or so individuals that had crossed borders from Benin through to Togo and entered through the land border into the northern part of the country. So this was sort of a very tough measure, but it was very good. And that would have isolated these other regions out, and then you just have the major ones to manage. Right. Unfortunately, as time went by, the system loosened up because people started resisting in some way and some form, and this also started the spread. So even though the consciousness or the understanding is there, government, the president kept communicating 2 times in a month from March to now, about 20 times. The president speaking directly, not like information from the presidency or through his spokesperson, the president giving update and sharing transparent information. So people understand and try to obey. But once they begin to loosen up, the small or the few linkages or leakages still keep the pandemic in the system until a significant effort is made again to isolate, perhaps, I don't know if that is even possible, but to isolate everyone and do another effective contact tracing and testing to isolate everyone, or in the negative sense, if it break loose, if all measures or trust break loose, then you have much spread from these small cases. So yeah, I think
those are the two. And the other thing might be, if we indeed, tried to figure out your indication that, it's really the separation of the areas that can really get us there, is what we've been talking about for a while. It's our green zone strategy. And yes, I agree that if we could just tighten that a little bit, then we might be able to get there, because we're actually quite close. And it is worth mentioning that Ghana, for those of you who don't know, is a population of over 31 million people. So it's not a small country, and it has, again, only under 100 cases per day. So it's comparatively speaking to the Western world, is very much under control. So let's open to questions, and whoever has a question, please either raise your hand or post the question in the chat. You're welcome to ask questions.
It looks like Justin James has a question, so I've asked him to unmute.
Yes, hello everyone. My question is for Desmond. After the death of J.J. Rollins in Ghana, did the people that weren't taking the coronavirus seriously started taking it more seriously, or did they continue doing the same things that they were doing?
I answered per question, Kachi? Yeah. Okay, Justin, thank you. Obviously, people started to take it seriously, but I would say the people within the political space, because before his demise, he the first person was his mother. He lost his mother, not through COVID though. And you could see the difference that the mother's funeral, which was just a week or so before his demands, the character of our political leaders during the mother's funeral was almost as if things are not so much scary anymore. And then after the former president himself passed, I mean, it was not confirmed that he had COVID, even though people picked the information and had started spreading. But then this also triggered the fear again, and then you realize that people, even ministers and other government people, began to put on nose masks strongly again, and to not shake at all, or to distance themselves. So yes, it did. In the rural and pre-urban areas, the difference was not as much, but we pick a lot of signs from the political leaders, and so when they are precautious, it sends a good signal.
Good. Other questions that people have, and if they don't, I will. So maybe you want to, Desmond, to suggest, you organized your organization for other purposes, and you've worked with many organizations in Ghana and other places in Africa. What recommendations would you have to others who would like to set up organization? How would you suggest that they go about it? Why don't we start with that?
Well, I hope I'm answering this in the right way, but I think in the world we live today, we have so many pressing issues that gives people a leverage on a number of issues that you can take on if you want to set up an organization. But I think it starts with the idea. It starts with the idea and the I mean, of course, you can be passionate, but it starts with the idea and your resilience, your belief that you want to solve a particular problem in the world. And if you have a strong belief that you want to solve a problem, whatever you do, whatever decision you take, and whosoever you think you want to network with, always you are doing this in line of this this goal of yours. In the case of GreenAfrica Youth Organization, at the beginning, we were just a few group of students who feel like we want to make a change because there was so much waste problems in Ghana, and every year we have flooding, and we actually lose a lot of lives during the rainy season. And at some time, we had a very big disaster that took so many lives, because we had flooding in the city, explosion from a gas station, and so we had gas, petroleum, petrochemical, different kind of petrochemical liquid mixed with the flood, and so the streets are on fire. Homes that are submerged are on fire. People who were trying to cross these streets or in their cars were all bent. So this also made us to have a feeling that we can cause a change. So the initial idea was just to create a community of conscious-minded people who know how to handle, dispose, and manage waste. But then as time goes by, we realize that there is a lot of people who are losing their source of income because either their climate change is affecting them in their farms, or they are losing their jobs because internet system is taking up their jobs. So we had to step in to implement projects that focus also on job creation, and projects. We continue the projects that are focusing on disaster risk management. So I think it's always the hunger to solve a problem. You have that hunger, and then you have to bring on board the right kind of people that you either want to learn from or you think they have the capacity to support you.
We have another question. Let me just see.
So we have a question from Galet and Tiffany. I asked both of them to unmute. Now go ahead, Tiffany.
Yes. Thank you so much for this conversation. We are learning a lot about what your efforts are and how we can apply them here in South Carolina. I'm in Columbia, South Carolina. I have a question about the vaccinations. With the news about vaccinations and with the arrivals of the vaccinations, do you see that people are becoming reliant on them as the savior of coronavirus, or is that not a discussion there in Ghana?
Of course, it is a discussion in Ghana also. Discussing, but it's quite more within the people in the medical field now, as opposed to at community level or people who are not so much in medical, who do not have so much medical knowledge. But then the other thing is that the corona pandemic in Ghana has gained so much media attention. So when something comes up, when there's a new thing, there is always first communication, of course, by the experts, but various communicators pick it up. So it travels far. When the first issue of the approved of vaccine came up, the medical centers said, well, yeah, hopefully in the beginning of 2021, we would be vaccinated, and then people will be able to go about their businesses. And then the 20th communique of the president, he said that the first quarter, maybe by March, we would have the vaccine in the country, and then they would vaccinate people, and starting with the people who are in the vulnerable age group, and also the medical people working in medical facilities and all that. But right after that, the media also extensively continue to cover this, and you hear so many platforms, people telling you why it is almost impossible for us to have the vaccine in Ghana at that time, in the month of March, for example, and also the fact that even when the vaccine is available, it is going to serve certain sort of, so to speak, wealthier nations before we would finally get it. And then the other issue that they also use to tell people not to relax their muscles is the fact that, for example, in recent case, a new strain in Nigeria, quite a more fatal mutated COVID virus in the UK, and I think another case in Australia. So they keep talking about all these things, and then the fact that if you think that vaccine has been made, you cannot even tell how good this vaccine is for the unpredicted nature of the virus. So I think it hasn't made people relax their guard yet.
Great.
Yeah.
Thank you.
Yeah. There's another question. Yes.
So Gillett had a question. She's unable to unmute, but I'll ask for her. She was just wondering, is Ghana in a state of lockdown right now? And if so, what type of measures are in place?
Unfortunately, not really. The country is, well, sort of a partial lockdown in the sense that essential businesses are going on. almost all businesses are going on, except the ones like entertainment and all those things. But businesses are going on, but people are constantly told to observe their rules. And then it is partial also because schools are still closed. So schools have been closed from the beginning until now, and they are not going back anytime soon. And the nature of Ghana high school, university is that you are always in the boarding house. And so government cannot guarantee enough, for example, nose mask or enough regulatory measures for these people. And so they prefer to keep people at home. However, usually it is not as it is with respect to the real situation, because even though there's partial lockdown, there's this constant communication, there are still things going on. And in the communities, a lot of people have lost the appetite to stay strong with the rules as they used to. And yeah, that is the situation at the moment. It's a partial lockdown.
Yeah.
Thank you. Does anyone else have a question for Desmond or Yaneer? Please raise your hand or alert me in the chat so I can ask you to unmute.
Okay. Desmond, maybe you would like to talk a little bit about how we can support each other.
Yeah, sure. I think always collaboration is a very key thing that is very necessary. And as I have said, we realize that every point have a limitation, whether it is the government, whether it is the work of the CSOs, or it is what the communities do. At some point, there is always this limitation. And I think those are the joints or the gaps that an external party can step in respect to GreenAfrica Youth Organization and some other social CSOs for that matter. I think what we do is always to fit in for what government cannot do. And in the pandemic, what government could not do was to go to the community level and make sure that things are communities are provided for. So government can give the instructions. You can put the military or the police on the streets. They would force the people to stay indoor. But that doesn't translate to the people not spreading it among themselves within households. And that does not translate to the people not resisting the stringent measures, because these are communities where they rely on informal activities. So where we step in is usually where resources are demanded. So I would say the first and most important thing for collaboration or working together is the part of resources, where we have to provide them either supplement food, or to provide them with the materials like a nose mask, like hand sanitizers, like some of the basic things that are very important for COVID regulations, but not super expensive. But then they cannot afford them because they stopped working. So what do they do? And in such situation, another thing that we can do is the part of knowledge. So in the part of knowledge, there are two things we can do. For example, right now, one of the things that Gayo did at the beginning was also text messaging and radio communication in the various communities, where people are able to have diverse means of getting information to us, or we have diverse means of getting information to people, so that they are able to tell if they want to say somebody have come home from far, or a visitor have come, or somebody have come through the borders, or a waste picker is facing this or that. And that is also limited as time goes by, because there is the need it requires resources. The other part of knowledge is so for that part, sorry, before I continue, for that part, what we currently doing, we started to develop a sort of a brokered tool, we wanted to develop something like a toolkit that is in the local languages, that is either voice, or it is infographics that we can distribute to places where you cannot have your constant presence on daily basis, and to help keep the momentum high. This, we couldn't go further, and we're still trying to develop it, because we do not have the resources, financial resources, for example, to do that. The second part is also that I would say with CSOs that demands collaboration, is also that most of the CSOs want to do the work, but the capacity in terms of knowledge level is also not there. So there is also this gap where collaboration can come in the form of learning from each other. What do you do? How are you doing it in your region? Whether you are from Asia, you are from the US, and you definitely have something. Even if the US have had so much cases, they still have tried certain measures that are quite effective. How did they do it, and how did they break this to the community people? And we can co-learn these things, because with the part that the communities play, just interlocal learning and sharing, it helps a lot in Ghana and in part of West Africa that I know of.
So the bottom line is there are resource sharing and there's knowledge sharing, and the knowledge sharing can be, expert knowledge, but it also can be learned knowledge from experience. And just as each community in Ghana was learning from each other, we can do that globally. And if we do that effectively, we will be much better everywhere at what we are doing. And in this sense, we could talk about it if you want. This is how I think about it, right? The virus, in mutating, is spreading its capabilities from one place to another. Our human capability is not in mutating, but human capability is in sharing knowledge that we can then do better by doing things from place to place. And I hope that we will keep doing that and do more of it as time goes on. So if anyone has a question, we can ask. I think that we've really learned a lot from this session. So Katie, if you have any other questions that people would like to ask.
Yeah, thank you. I'd like to bring forward a question from Roger Rum. He's unable to speak, but I'm going to ask his question. He's just wondering your opinion on how ethical it is to publish research on pandemic issues for which the outcomes are still explorative.
So are you asking Desmond or me this question? Either one can answer.
It's either one of you can reply. And Rogerman comes from India from his question. So thank you. Thank you, Rogerman, for your question.
Actually, I couldn't hear the question well. Can you take it again, please?
Oh, sure. So it's a question about the ethics of research, publishing research before the outcomes are still really known.
Yaneer, you want to take this?
I'll take that. I'll be happy to take it. I think the answer is that there are really two conversations that should be separated. Communicating research results is super important in the academic context. Early communication, rapid communication to help each other advance the research is very important. On the other hand, there is a problem with publishing it in the public sphere. And the reason is because people with partial information can take that information and make decisions that are not based upon sound information. So there has to be an evaluation of risk and decision making that is different from the issues that are present in the context of the academic community. Separating those two conversations is not easy in a world where information is free flowing, but it is an important challenge that it's clear that we're facing. And it's also important in that, partial claims that people make tend to excite people. They get, interested in things. And there is, there is this issue of communication by through the public, which would be not as good as if the academic community is pursuing its work and checks its results carefully and then engages with the public so that it can be better informed about what actions and the opportunities that are available from science.
Thank you, Yaneer. There's another question from Kwame. I did ask you to unmute if you are able. I will ask your question. It's also in the chat. Kwame asks, did the National Civic Communication Authority, NCCA, in Ghana play a role in sensitizing the general populace about COVID-19?
Yes, they do. So the NCCA is actually the authority that is responsible for this kind of communication as far as the experts have given the go ahead, and they do. However, and I think this is more of a personal opinion. I believe that if you ask a lot of Ghanaians, they would tell you that this is an authority that is not as effective as it should be. And people begin to have more faith in either the political hierarchy, people who are in the government, or listening to people who are in the government, or people who are politicians, or rather they trust themselves. They trust the community leaders. They trust the CSOs who go into these communities, whether they are experts or they are not, because at least they make things available to them. At least they make the information available to them as compared to waiting for the communication authorities.
Thank you, Desmond. There's another question from Richard Ballarand. He's asking, is there effective regional coordination in Ghana?
Particularly with reference to Côte d'Ivoire and that sort of cooperation.
International cooperation.
I see.
Oh yeah, yes. I think effective is I would say not so effective, because how it is now is each country trying to keep other people away. So in Ghana, for example, when the lockdown started, you couldn't cross to Côte d'Ivoire at all, and now you could in some cases, but you are tested. So whoever is, if you are coming in as well, you are tested. It's just the same like the external borders that come from through the port or through the airport. So Ghana, Côte d'Ivoire, Ghana, Burkina Faso, Ghana, Togo borders are still closed as at now, except in essential cases where you have to cross, but you are also tested before you cross. And this is this, even if it can be made more stricter, is good, because if you take South Africa, for example, you can see that when you loosen your external borders, the danger is so high. In about beginning to the middle of this month, we had people queuing South Africa Zimbabwe border, people standing in queues either to go to Zimbabwe or to go into South Africa, and it was the same with other borders. at a point, either, of course, there were only one test center in one border, or even less test kits. And at a point, some people, they just have to let some people go, either cross or go back, because people were dying in queues. And because people were dying in queues, and you cannot just keep them hold up until they get tested by one individual or something, they crossed, and you cannot tell whether they crossed with the virus or they did not cross with the virus. And now that we have such a surge of cases in South Africa, you can attribute it to almost a variety of factors. So this regional and internal border checks as is very essential. And I think Ghana is not very effective, but it is. And I'm saying it's not very effective because we had one of our cases, it was regionally transported. It wasn't flown in from through the ports.
So maybe we'll take one last question.
All right, well, that's great because there is one last question in the chat, again, from our friend in India, Rogerman. How would the COVID-19 pandemic reshape education? Who would like to take on this one?
Well, that's a very, very big question, obviously. I don't know whether we want to grapple with it fully. I think that what we can say is that the idea of remote education is getting trials. At the same time, I think people realize that children in schools is much better, but in order to get there, I hope that we will take this much more seriously. We really need to have community transmission controlled. And once we are controlling community transmission, then we can open schools safely. And that's fortunately the right way to go. And the fact that children are being held at home in Ghana and other places is not what we want, but we have to solve the problem in the right order. And that's, I think, where we have to go. Desmond, I don't know if you want to add something.
Nothing so different, but I think in Africa, I think one of the good part of this in terms of education is the fact that we've seen a lot of startups from people, for example, going into sort of robotics, going into doing some sort of engineering stuff that facilitated. We had people in Ghana specifically, we had young people who started to make ventilators out of electronic waste, people who had to make, who started to make certain sort of machinery that helped to with a touch, you are able to do all the things that you want to do. For example, it gives you liquid soap to wash your hands, gives you water to rinse and all that. And people are beginning to appreciate, because we've been all this year always very focused on, I don't know if to say the British kind of education, but then we churn out so many graduates who come out and sometimes they find it so much difficult to get a job because we are not able to make it as practical in the classroom as possible. And this makes people to know that if you are even going, if you have the opportunity to be back in the classroom, you have to know that things have to relate to the real world situations. And so I think going back to school, one, I think people might have would start thinking of means to study outside of school, and then even going back to school, I think it would it will increase the level at which people trust their knowledge in the school.
Okay. Well, thank you very much, Desmond. It's really been incredibly helpful and important, I think, for our audience and for us. And we will be sharing this online. And I look forward to working more with you. Hopefully, we will be able to address the problems, the remaining problems in Ghana, and then we'll learn from you more how we can do things better in many other parts of the world. So thank you very much. And,
yes,
if
thank
you
you
have-
so much, Desmond and Yaneer. We have recorded this session and we will be posting it on our YouTube NECSI account. And it also will be available on our EndCoronavirus.org Facebook page. So please look out for it there and share it widely. And thank you again, Desmond, for joining us. It was a pleasure having you and meeting you and hearing from you. And thank you all for attending today and participating. Kim can put in the information in the chat regarding how to stay connected with EndCoronavirus.org. We're always looking for more volunteers to help out to improve your community. So thanks everyone so much and have a great day.
Take care.
Thank you
Bye.
so much, and have a great day too. Let's stay in touch and yeah, see what we can do together.
Absolutely, would love to. Take care. Bye.
Bye-bye.